guys, welcome to week 1, day 1, science. Today you will be working to earn 5 stars. When you get your 5 stars, you can choose a reward. Let's watch our anticipatory set to try to figure out what our lesson will be about today.
If your family ever needs to use the emergency departments at Cincinnati Children's, we want you to know what to expect. You're making a choice to see one of the strongest pediatric emergency teams anywhere. Parents Magazine recently rated us the #2 emergency department for children in the whole country. Our emergency departments care for patients with different levels of illness or injury, and we focus on checking your child for dangerous conditions that need treatment right away. Children arrive through our front door, ambulance bay, or by helicopter. We care for the sickest children first. This can result in waits for other families. We try hard to evaluate each child as quickly as possible. We appreciate your patience while we handle the many emergencies that come to us. If you're not sure why you are waiting, please ask one of our staff members. Here's what we will do together when you bring your child to our emergency department. We'll register you. A nurse will take your child's vital signs and make sure your child is safe. You may need to wait in the lobby. We'll take you to a treatment room when one becomes available. Our team will examine your child and order any tests, treatments, or medications to help in diagnosing and treating the issue. For many illnesses, tests and treatments aren't necessary. Our nurses and doctors will work together to monitor your child's progress and plan care. At home, please follow your doctor's instructions and take any medications as prescribed.
Thank you guys for viewing that with me. Hopefully that gave you some ideas of what we might be talking about this week. So here are the steps to testing an idea. Listen to the question, make a prediction, analyze the information, and check your prediction and make a conclusion. Based on the video, what do you predict we will learn about today? Do you think we'll learn about school, racing motorcycles, or medical care? That's right, we're going to be learning about medical care for the next couple of weeks in science. Good job! You earned a star. Steps for synthesizing knowledge. You need to listen to the teacher, listen to the whole lesson, think about the information now, and think about the information later. So here's what we'll be working on. We can identify where to go to get medical care based on our medical problem. That will be our goal. Let's look at our essential questions. This video will focus on where can I go to get medical care? How do I know which option to choose for medical care? Let's learn some new vocabulary terms. Medical care. Medical care is finding and treating sickness or injury. Doctor's office. Doctor's office is an office where people who are trained to help people who are sick work. Next up, we have emergency room. An emergency room is a room in the hospital for people who need help immediately. Dental office. This is a place where a dentist works and can help you with your teeth. Fantastic job reviewing vocabulary. You earned 2 stars. Our unit will be about community medical care. Our first question we want to answer is, where can I go to get medical care? Where? Then we want to know, how do I know which option to choose for medical care? So how do I choose? Well, you will choose based on your medical problem. Let's learn how to do that. Here you can see some pictures of the emergency rooms, which are at hospitals in our Charlotte area. This one is actually very close to Metro School, the Carolinas Healthcare System emergency room. You should go to the emergency room when you have severe, very, very bad abdominal or chest pain, when there's a baby that needs immediate care, when you have a serious eye or head injury, when there are severe burns, stroke symptoms such as numbness or paralysis or slurred speech, significant difficulty breathing, symptoms of a heart attack, very, very high fevers, or a suspected drug overdose or poisoning. Okay, based on what we just saw, why might someone need to go to the hospital for a heart attack, a minor headache, or a minor stomach ache? That's right. If someone's having symptoms of a heart attack, they need to go to the emergency room in the hospital. Amazing job. You guys have earned 3 stars. In these pictures, you can see some urgent care facilities in the Charlotte area, such as Novant Health and Concentra. You need to go to medical or to urgent care when there's a allergic reaction that is not very severe or life-threatening. When you have broken bones, they have an x-ray machine there. Sprains and strains, cuts that require stitches, mild fevers, minor burns, if you have pink eye, animal or insect bites, or cold and flu symptoms. You can pause the video to compare and contrast some of the things that you should go to the emergency room for versus urgent care. Let's review the steps to critical thinking and problem solving. First, listen to the question. Listen to all your answer choices. Think about your choices. Answer the question by choosing one of the answer choices. If you have a very high fever, where should you go? Should you go to urgent care or the emergency room? You should go to the emergency room. Good job. If you have a broken bone, where should you go? Urgent care or the emergency room? Make a choice. Urgent care. Good job. If you have a cut finger that requires stitches, where should you go? Urgent care or the emergency room? Good, you should go to urgent care for a cut that requires stitches. If you have a serious head injury, where should you go? Urgent care or the emergency room? You would go to the emergency room for a serious head injury. Great. Awesome job. You guys have earned 4 stars. Now let's talk about a primary care physician or a pediatrician. So, a primary care physician is like your family doctor. It's the doctor that you go to for physicals every year for checkups. It's the doctor that you can make appointments with and call ahead. And they can take care of a lot of your needs that are not very urgent or that are not emergencies. These could be things that you're struggling with over time or things that your doctor is helping you to figure out over time. And they may be someone that you know and that you're familiar with. A pediatrician is kind of the same thing, but they usually focus on working with children. So you may go to a pediatrician depending on how old you are. Here's an example of a pediatrician's office in Charlotte. Now, when should you go to your primary care physician? Well, you can go see them when you have a rash, sprains and strains, cold and flu symptoms, sore throat, animal or insect bites, and pink eye. A lot of these, you guys may notice, are very similar to when you would go to urgent care. So some of these, they may overlap. You may be able to choose between your primary care physician and urgent care. Maybe it just depends on if your primary care physician has an appointment available. There are also many other things that a primary care physician can do for you. Here are some reasons why you should go to the primary care physician even if you're healthy, even if nothing's wrong. Well, you should go get checkups and preventative care. So, you do maintenance on your car and your lawnmower. Why would you not do it on your health? Make sure everything's okay. Every once in a while, get everything checked out. Okay? You may also need to go get some shots from your doctor every once in a while so you can stay healthy. Just because shots are not required doesn't mean that they're not recommended, so make sure you ask your doctor about what you really need to have done. Okay, don't let your family tree shake you. That means make sure you know what kind of diseases run in your family so that you can ask your doctor to test you and to look out for those signs and symptoms of those diseases. This one says most medical professionals recommend consulting a physician before beginning an exercise program, even if you are healthy. So that is why when we go to Special Olympics, you guys have to go to the doctor to make sure that you guys are healthy and can participate. So you want to make sure you don't get hurt or don't overdo it. Talk to your doctor first before changing in exercise. Okay, and know what food is right for you. Make sure you know what is healthy and what your doctor recommends for you to eat. Some people need to be on special diets or may have allergies and food restrictions. Your doctor can help with that. Okay, let's talk about the dentist now, you guys. So, we're going to go on a virtual tour of a Charlotte dental office. Now, if you guys want to do this on your own so you can take a little bit more time, just ask your teacher to go into the Google slide and you have access. Okay, so what you do is click on these arrows and it'll take you around the office. Are you ready? Okay, well, let's see. This is the waiting room. Let's go back and see if we can find a table. Ooh, here we go. Okay, do you see the chair? That might be where you sit at the dental office. Oh, here's another. You can see another chair, all the tools that they have at the dentist. Great, you guys. Sorry, I'm not very good at navigating these things. Okay, so you guys can go through, do a little tour just to make yourself feel more comfortable next time you go to the dentist. Know that there are all these rooms and there's all the people there to help you. Sometimes the equipment can look scary, but really, it's not so bad. It's all there to help. Okay, I bet you guys will be better at doing that than I was. Okay, so when should we go to the dentist? Go to the dentist when you think you might have a gum disease, gums may be hurting. When you have mouth sores, ouch. If you have toothaches or any dental emergencies, if you have tooth sensitivity, maybe it hurts a little bit, maybe the nerves are hurting. If you have cosmetic needs, like maybe you have some teeth that are crooked that you want for the dentist to look at. If you have bad breath that you just can't shake, or if you have any tooth decay, any black spots on your teeth or anything that you think may bother you. So you also want to make sure you have a checkup and a cleaning every 6 months to a year with the dentist. This will hopefully prevent you from having these issues that are on the right. Okay, there's something called an ophthalmologist. So this is an eye doctor. They pretty much handle anything to do with your eyes. You need to go to the eye doctor when you're maybe having trouble seeing things that are close up or far away. If you wear contacts or wear glasses, you'll need to go to the doctor to get your eyes checked every once in a while. Or if you're having any issues with irritation, redness, scratchiness, any of that, the eye doctor can help. There's also something called an audiologist. So an audiologist is an ear doctor. They can help with any issues with hearing or ear infections. So what exactly does an audiologist do? What do they do? Well, an audiologist can fit patients with hearing aids and instruct them on how to use them. They can counsel patients in dealing with their hearing difficulties. They can examine and assess patients with ear problems and diagnose the root of their problems. They can help with teaching patients alternate forms of communication, such as sign language and lip reading. And they may monitor treatment of patients for progress or problems. Okay, let's listen to so we've listened to the lesson. How does this apply in the school? How does this apply in the community? How does it apply in the world? Let's take a field trip to the animal hospital.
Hi, I'm Miss Penny, and these are the Kid Vision Kids, and we're here today to find out what happens at an animal hospital. I brought my dog Boss in for a checkup.
Well, welcome to Emerald Hills Animal Hospital. Would you please fill out this form?
Yes, we will. Okay, guys. Let's sit down. Come on, Boss. First, this says, type of pet. Is he a bird?
No.
Is he a rabbit?
No.
Is he a cat?
No.
Is he a dog?
Yeah.
Yes. Would you please put an X on the dog? Doing a good job. Perfect. And what does it say at the top, Michael?
Pet's name.
Pet's name. His name is Boss. So could you please write Boss? Perfect. And now the last question is owner's name. And my name is Miss Penny. So I'm going to put Miss Penny. And that way they know all of Boss's information. Great, we filled out all of our forms, so let's go check him in.
Come on, Boss.
Here we go. Okay, we have all of our forms filled out.
Well, thank you so much. The veterinarian will be right with you.
Okay, terrific. Let's have a seat while we wait.
The veterinarian will see you now.
Ray, let's go. He's ready.
Hi, Kid Vision kids. I'm Dr. Tapper. I'm a veterinarian. Thank you for coming to see me today and bringing Miss Penny's dog so I can make sure he's staying healthy.
This is Boss. He looks like he's ready for an exam. What do you do for a regular checkup exam?
Well, we usually start by having them set up a little bit. Then we open their mouth and we check their teeth, make sure they're clean. We actually look in their eyes, see the nice whites of their eyes. We actually will use our stethoscope. Do you know what that's for?
What do you use?
Check their IPV.
We listen to their heart. So we're going to listen. Do you want to try to listen?
Ah, fun.
I'm going to put that in your ears. How about now? You want to let your sister listen?
What does it sound like?
Something.
It's thumping.
So another thing we'll do is we'll actually look in their ears with an otoscope.
Otoscope.
Nice and clean. The other thing we'll do is we'll take an ophthalmic scope and we'll actually look in his eyes. It's okay, boss. I know. He's good and healthy. And then lastly, we'll usually feel their whole body, check to make sure there's any lumps or bumps. He's good.
And how about their paws?
And we'll look at their paws and their nails. He's got big feet, doesn't he? Flex their arms a little bit, make sure there are no problems. And Boss is a really healthy boy.
So an animal hospital takes care of animals just like a pediatrician would take care of young children or a regular doctor would take care of an adult.
Correct.
Okay, great. And so when you have an animal and it needs to have a checkup, where do you bring it?
To the veterinarian.
And what is Dr. Tapper?
A veterinarian.
Excellent. Good job. Good job, Boss.
So,
All right, thank you guys for watching that with me. You have earned your reward. You got all 5 stars today in science. Great job, you guys. Now don't forget to complete your Google Forms activities. Hope you guys all have a great day. See you next time.